So neonatal hypoglycemia is a condition where a newborn's blood glucose level falls below the normal range needed to maintain brain and body function. That's when the blood glucose level is less than 45 milligrams per dl or 2.5 millimole per liter after birth. Some use less than 40 milligrams per dl or 2.2 millimole per liter as the lower limit in the first few hours of life. So today we'll be looking at the management of hypoglycemia in neonates. So the immediate goals of management is to restore normal blood glucose levels quickly, to prevent neurological injury due to low glucose, identify and treat the underlying cause. So in the initial steps, you keep the baby warm, that's to prevent cold stress. You ensure airway and breathing are normal. You check blood glucose using a glucometer. So treatment based on blood glucose level can be asymptomatic or symptomatic. So in an asymptomatic neonate, that's a neonate that is presenting with no symptoms, you check if the blood glucose is less than 45 milligrams per dl, that's 2.5 millipole per liter. You feed immediately with breast milk or expressed breast milk. You recheck after 30 minutes. If still low, you give 10% dextrose intravenously bolus. So in a symptomatic neonate, that's a neonate that is presenting with symptoms such as jittering, lethargy, seizures, apnea, or poor feeding. You give IV bolus, that's 10% dextrose, 2 ml per kg, which is equal to 200 mg per kg glucose over 5 minutes. Follow with continuous infusion of 10% dextrose at 6 to 8 mg per kg per minute, which is approximately 60 to 80 ml per kg per day. You adjust to maintain blood glucose to greater than 45 milligrams per dl, that's 2.5 millimole per liter, exceeding the lower limit for hypoglycemia. You recheck glucose every 30 to 60 minutes initially, then every 3 to 6 hours once stable. So in persistent hypoglycemia, that's if glucose remains low despite infusion, you increase glucose infusion rates gradually up to 12 mg per kg per minute if needed. Consider underlying causes like sepsis, hypothermia, perinatal asphyxia, endocrine or metabolic disorders, e.g. hyperinsulinism and adrenal insufficiency. So after stabilization, you start or continue frequent breastfeeding, that's every 2 to 3 hours. You wean off IV dextrose gradually once baby feeds well and maintain normal glucose. So in the monitoring, you monitor regular blood glucose, that's you check for blood glucose regularly for at least 24 to 48 hours. You watch for recurrence of symptoms. Thanks for listening.